like to just say a few words about our first guest speaker, who was introduced to me recently through Sapien Care Group, and that's Trish Kelly. She's very kindly agreed to come and talk to you all this afternoon and to tell her a little bit about her amazing story and her journey in the health and social care world. As you will hear, she brings a lot of experience into the room today. So please listen, learn, and enjoy what she has to say.
My name is Tricia, and I'm a senior consultant for Fulcrum Care. When I was about 14, my mother and father both worked in public health. Well, my mother was a nurse, and my father was a policeman, and they used to try and encourage me to do things and give things back to the community. At that time, I was a 14-year-old girl, and all I wanted to do was put makeup on and go out and be with my friends. But my mother volunteered my services at a local MenCap, and I used to go there every weekend and just volunteer my services. And I recall and I remember like it was yesterday, for the first 4 weeks, I was so scared. I didn't know what it was, what I was supposed to be doing, and I was so nervous. And I used to cry, and I never wanted to go back. And my mother kept pushing me, or shall I say, encouraging me. And then after about 5 weeks, I remember getting ready in the morning on a Saturday morning. It was 8 o'clock, and I was bouncing, and I wanted to go, and I thoroughly enjoyed it. And I carried on doing that for 2 years. I worked my way up the ranks. So I was a T girl, going on to a carer. Then I went on to become a senior carer, started getting my qualifications. And then I decided.
Hi Trish, I just wanted to know what was your most proud in moving to health and social care, what achievements you were most proud of?
What was your proudest moment in your career in health and social care? Good afternoon to all of the students and staff at Hubert College, and welcome to our second in our series of health and social care webinars run in conjunction with Sapien Care Group and Hubert College. This afternoon, we look forward to welcoming Fedra Dimis, who's a dietitian, and Kay Crotty, who's a physiotherapist, to hear a little bit about their careers and experiences in this sector. To get an idea of what's inspired them, what they've enjoyed, and what they've perhaps found quite difficult about their career and a lifetime in health and social care.
Oh, good afternoon, everybody. It's an absolute delight to be here to share my physiotherapy journey with you. Obviously, all of you are already on a health professional's trajectory, so you're one step ahead of where I was at around your age. So that's great. I started thinking about doing physiotherapy when I was a little bit younger, but there weren't courses in those days that we could go on to guide us into where we might like to go. But I decided on physiotherapy because it seemed to me that it was a profession that you actually treated people. If you think of a prescription that you get from a doctor, they give you a prescription. It seems to be a prescription for medication. Whereas physio, when we do a prescription, we're actually delivering the treatment ourselves with our hands, thinking through care plans and everything, and constantly changing that care plan to suit the patient. So that was something in the first place that attracted me to the profession. I remember the first time I had a lady I'd been working on for about 6 weeks when I first qualified. She'd had a terrible stroke. And I used to go down to the big gym with her in the hospital. There were loads of people in there. And the day that she took her first steps, I just did this tremendous scream and a jig all around the gym. And everybody laughed. If you're willing to work, put the hours in, you can get there. And who knows, you may even get a PhD ultimately as well, travel the world. And in the meantime, really look after loads of people and have a very, very satisfying career.
Hi there, I'm Phaedra. I'm very pleased to be here today to talk to you about my journey in dietetics. It's been quite a long journey actually, and I've developed a lot of specialities along the way and special interests in nutrition. It's a very controversial subject, nutrition, and there seems to be a lot of people who feel that they're they know more about it than us. So it's very important to have people involved in the medical team, like dietitians, who absolutely know a little bit more than the doctor about, nutrition and how to treat different patients. A lot of the future in dietetics is gut health, gut hormone health, and how food, reacts in the gut, and food intolerances. And, a lot of people are phoning up to make outpatient appointments for food intolerances, just simply. And we find that a lot of inflammatory bowel conditions can be treated in this line as well with the FODMAP diet. So it's a big breakthrough in dietetics, which is another reason, to become a dietitian. It's certainly not all about weight reduction and diabetes as it used to be in the old days. We've really, really improved, and our profile is very much higher, especially with regard to stroke and diabetes, and treating any therapeutic disease by diet. So you really want to get the patient monitored and maintained on the least dose of medication. So that's exactly what you want to do. You really want to, as a dietitian, look at their condition, look at the medication, look at the side effects, and see if your diet that you design for them, every diet should be tailored to the individual, because you can get lots of things going on. Everybody's an individual. You can't just give the same diet for every diabetic. You can give general information. But what we do is we tailor the advice to the individual. So you get a lot of reward from that. And, the reward is getting patients off medication.
So I thank you all for coming and listening to us this afternoon. And thank you so much, Kay and Phaedra, for sharing your lives with us. I found it really interesting. Thank you. Afternoon to all of the students and staff at Hubert College, and welcome to the third of our webinars for health and social care students in conjunction with Sapien Care Group with Philippa Law Comparing, and I'm Robert Powell, I'm the Managing Director of IPS. So this afternoon it gives me great pleasure to introduce a gentleman by the name of John Spencer, who has spent his career in the areas of gynecology and termination, which is a very controversial subject at the best of times. So I hope you enjoy this afternoon's webinar.
It's been an interesting and some might think quite a long career. I qualified in 1976. I suspect many of you were a twinkle in somebody's eye at the time. So for 40 years, I had a career in the National Health Service. Broadly speaking, it's 10 years of training after qualifying as a student. So I was appointed a consultant in 1986. And my consultant career was 2 years of National Health Service obstetrics and gynecology. That's broadly speaking to do with women having babies and women's problems generally, and that spans right through from cancer right through to family planning really. Then the final 10 years of my career, I took a change. I went to work for the sexual and reproductive healthcare charity called Mary Stopes International. It's rebranded its name to MSI Reproductive Choices. If you now Google it. And I was their first consultant. And the evolution of my period of 10 years there has ended up with them now having a medical director. So they've become quite a serious healthcare organisation, but they're not in the NHS. There are so many anecdotes. I mean, how long have you got? But I'll tell you one sad story that when I was in my first 10 years still training before I was appointed as a consultant, I was called to see a young woman, I think 17, 18, who attended the accident and emergency department and was forwarded on to the gynecology department, the ward. And she came in, she just said she's had a miscarriage. And I was on duty, so underwent the examination. And quite surprisingly, I saw the signs there of something much larger than miscarriage. And so I don't remember, I think it was the before we did routine scans. Anyway, for whatever reason, we took her into the theatre as we did in those days. That doesn't happen now. One can do what's called evacuation of any retained tissues and that kind of thing now without necessarily having an anaesthetic. But we're going back a couple of decades or more. Don't always like to remember that, but took this young woman into theatre, examined her properly, made sure everything was clear, and quite clearly she had lost term pregnancy. In other words, a pregnancy that was a lot bigger than just 3 to 4 months. So when she woke up from the anaesthetic, I went back to talk to her and gently counselled, and cut a long story short, she had an unwanted, undeclared, and in fact unrecognised pregnancy until the day before. Went into labour on her own and went out into the back garden, into the shed, delivered this rather surprise package into a bucket. And then took the baby's body, wrapped it up in newspaper, buried it in the garden, came back indoors, called the ambulance and came to us. And that was the following morning. We were talking to her and we got her to accept the fact that all this needed to be declared and so on and so forth. And as we were finishing that conversation, the police turned up. Because, of course, I don't know, a parent or somebody had noticed the trail of blood from the shed back to the garden and the house and so on and so forth. And so the law for that technically is infanticide. But the question, of course, would be whether or not the baby was delivered alive and then died, or was actually a stillbirth. And the answer in this particular case is that it was impossible to say. So the death was registered as a stillbirth. The incident was registered as stillbirth, which took her out of the reach of the law. And she had appropriate counselling. And, you know, it's just a very sad end. Fortunately, the reason I choose this story is it's not someone who's died from complications. It's not someone who's had a real problem. She'll have some psychological issues to deal with, but she's still healthy. So there we are. It's just one story.
Thank you to everybody who's come to listen to John talk this afternoon, and Philippa and Tina for asking the questions. I mean, that was an incredible webinar. I'm lost for words, and I'm in total admiration for what you've done in your career, John. So thank you so much for coming on this afternoon. That was absolutely fascinating and quite moving, actually, as well. I think it's impossible to talk about it without being emotional. But thank you so much. It's brilliant.